MedBix webcast is a new kind of healthcare media channel to break the silo mentality and foster interdisciplinary thinking. Our mission is to fill that gap and to create a curiosity through different lenses, tapping the passion that guided the historical figures in medicine and bringing present-day groundbreaking research to the front lines. We interview physicians and leaders in the industry about present-day healthcare challenges on our live programming. Hey, welcome to the MedBix webcast. I'm the host, Ramana Raju. I'm not Albert Einstein, but we're going to talk about some of the things, intellectual stuff. So I have a very interesting guest, that after that, I'm going to present a topic on quantum computers and then come back and talk to the guest. And let me, when I was growing up in India, I used to watch these, we have a lot of religious ceremonies, like the pilgrimage. You have to go to special kind of functions, really Hindu functions. We used to go. A lot of people, we have to. I'm from a small village. We have to cross the river. We have to cross the small boats. We have to go through the boat, and then these boat operators, they want to maximize the profits. They put a lot of people inside. And then usually they sink every year. One or two boats sink, and they get a big news. People die, and some people survive. I was thinking as a kid: is there any solution? Is there any prevention solution? If they're drowning, is there any treatments? All these things I didn't know. My father is a doctor, but he's not like he's not this in the Western sense. He's a village doctor. But we don't know the management structure. So actually, I come to know this Dr. Donahue. He's a PhD. He's a military man. He is a lieutenant colonel in the U.S. Army. He's a decorated colonel. And then after that, he spent a long career in the military. Then he came back. Then he got a PhD in health education. Health education, where my field is now. I teach now all the different things, not for students, but in general particularly for the healthcare professionals about the new subjects. He got a PhD in health education. After that, he was teaching in University of Maryland. Then he was affiliated kind of adjacent faculty member for the Harvard, teaching about the disaster medicine, emergency preparedness. Now he is the president of it's called WADAM. The world is a disaster preparing the disasters medicine and train the healthcare workers, not only doctors, nurses, all the people around it, and the government officials probably around that structure. The entire thing they prepare in case if there is something happens. How do you prevent that? I was listening. Actually, I watched a trial a little bit in Michigan. There's a guy got pissed off at his girlfriend. He took his truck and rammed onto the people, and he injured a lot of people. He killed a few people and then injured a lot of people. Just a vehicle ramming. He took his truck and then ramming into the crowd. So that what is it medicine do? I was really learned something new. It is saying that injury patterns. How do you manage that injury patterns? So some people get hit by some of them are minor injuries, some of them are major injuries, some of them are broken bones. So you don't have to fill up the hospitals first because you're going to get the emergencies. Some people have abdominal bleeding. They need to be taken care first. So this kind of prioritizing this whole process is really itself is a management. And I learned it from Donahue's the organization WADAM. Let me bring him to the table. He has a long, distinguished career. I'm so honored to have him on the stage. Dr. Donald Donahue, thank you for your service, sir. Welcome back to the MedBix webcast.
Thank you. Good evening, Ramana. Happy and privileged to be here.
Tell us a little bit about your background. I gave us some of your background. You have such a varied background. I told you that I had a very hard time preparing for your background. So tell us, you are starting from the you go ahead. I'll let you.
I feel truly blessed. I have had a phenomenally diverse background. I At 21, I was kind of lost. I was in college, so I joined the military, the United States Army, for what was supposed to be 3 years, and 3 years turned into 28 years. I have worked in or with every aspect of healthcare, including physical health, ambulatory care, acute care, mental health, dental health. I've just, while I believe in, and I hope that I'm technically proficient, I've also been the beneficiary of just, sometimes what I tell students, never discount serendipity. So wonderful opportunities have come my way. I've had great opportunities to influence national policy, to work on the international stage, and to really work diligently. I come from a multi-generational family of firefighters, so public service is in my DNA, and I feel blessed to be able to serve the public.
Thank you for the service. You were involved in while you are in the military, you were involved in the anthrax. I remember anthrax episode, some people mailing the anthrax in the post office. Tell us that incident and how you got involved with that.
Oh, that was clearly a serendipitous incident.
Mhm.
I was in the military. I actually got off of active duty, and I was a reservist, and was mobilized and went to Europe for the peacekeeping mission in Bosnia. When I came home 9 months later, my civilian job had changed dramatically, and it became obvious that I wasn't welcome for whatever reason. Uh, the second week I was back, I got a call saying they're looking for someone to come to the Pentagon and work on a special project. The special project was designing the anthrax vaccination program. I spent the next 6.5 years in the Pentagon, worked on anthrax, worked on smallpox. I lived on Capitol Hill. And when the attacks happened shortly after 9/11, uh, I knew actually went to church with the deputy chief of staff from Tom Daschle's office, who was standing next to the intern when they opened up the anthrax laden letter. I wound up, because of some unique connections and capabilities, I wound up traveling the country. Uh, Eventually, once they realized what was happening, and the anthrax was such that it literally floated around like dust, they realized that the response team from the Public Health Service and then the regional reference labs that took the samples were all in danger. So my role was to travel the country and present present the facts on anthrax vaccination, anthrax treatment, and the danger of anthrax to people handling it. It was a unique opportunity at a really stressful time, but I was grateful for the opportunity to contribute and do good.
You have to coordinate this. You have to coordinate with the CDC. Tell them what is the coordination. What is the requirement of what kind of a coordination you do with the CDC.
It was rather indirect. The the CDC realized that they had to present education to a community that they had never worked with directly.
Okay.
They reached out. They actually reached out to a company that was running a program that provided medical and dental services to members of the National Guard and Reserve. And they realized CDC realized that this company was one of the few firms that could administer anthrax vaccination. So CDC reached out to the company. The company reached back to me in the Pentagon and asked. And the very first presentation I gave was at Atlanta. Was Atlanta to the CDC response team. that went to the sites where the anthrax attacks had happened. Uh, it was exciting, a little bit of humbling, and it was humbling to be able to say, okay,
Yeah.
I'm briefing the CDC on how to deal with anthrax.
Yes, that's it. So you're coordinating all these things that the CDC and the military and the general public, civilian population. You have to coordinate all of them together. It is a humongous task, and educating them. Not only because coordination means education. All of them required. And you did a. After that, you became a professor. So you went to the school in University of Maryland. You were doing some program there. Tell us a little bit about that. You were teaching background a little bit.
I've always known that I wanted to teach. After I retired from the military, I pursued my doctorate, and which is, as you indicated, was in health education, kind of a unique degree. Uh, and I like my first job was with the University of Maryland University College, which focuses on adult learners. So the average age of my students was almost 38 years old. I
Okay.
had physicians, nurses, dentists, PharmDs, uh, people who've been in. I remember one student who enrolled in our program. He had come from, I forget what nation in sub-Saharan Africa, and he had been in the United States for 8 weeks, and he enrolled in our program. So it was amazing opportunity to interact with people out there working in the field, and teach them about healthcare administration. And I actually had two programs. One was a master's in healthcare administration. The other was a certificate and a master's in global health. So teaching people not only how to operate the health system of the United States, but the relevance of global health, and the fact that disease knows no political borders.
Yeah.
Tragedies know no political borders. So
Yeah,
preparing people for that, and it really positioned me for the work with Wadham and with some other organizations that I'm doing now.
now you're a president of the World Association of Disaster Emergency Medicine. Tell us that organization, what they do, and what is their role and functionality of the organization.
The WADAM, the World Association for Disaster and Emergency Medicine, was formed in the late 70s in Mainz, Germany, when about 10 people got together, but there were two founding members who were anesthesiologists, but they named themselves resuscitologists, and their philosophy was that we could get better, we can improve the way we deal with trauma and how we save lives. It was originally called the Club of Mainz, and it evolved to now the World Association of Disaster and Emergency Medicine. It's an international organization. We have nurses, physicians, scientists, emergency medical technicians, and our role is to advance the science of disaster medicine, which is an emerging field. Disaster medicine is less than 20 years old as a concept. And come up with the science, design the science, promote the science, promote evidence-based practice, and develop the capability to, as you indicated, develop the capability to respond to overwhelming circumstances and healthcare disasters, which multiple studies, including some recent studies out of a university in Leuven in Belgium, there are more infectious disease, epidemics, pandemics, disasters are more frequent and more severe because of rapid global travel, because of climate change, and many factors. Uh, humanity is increasingly at risk, and our role is to reduce that risk.
You were recently in Riyadh, Saudi Arabia, right? So
Yes,
tell
sir.
us the conference a little bit.
That conference is one of our board members in Wadham is Dr. Anas Khan. He works for the Ministry of Health in the Kingdom of Saudi Arabia. And the conference in Riyadh was the fifth global conference on mass gathering medicine. And mass gathering medicine, you talked about the pilgrimages in India, Hajj in Saudi Arabia, uh, World Cup matches. Does mass gatherings present unique challenges to keeping people safe in the first place, and in responding to issues, responding to things when they happen. Crushing, stadium collapses. They're because you have so many people, so much humanity in one spot, that creates logistical and clinical challenges. And the conference in Riyadh was to educate, to promote best practices, so to advance the science, and significantly to advance the research and the publishing, the distribution of knowledge, because it's a new field, and because you cannot do true scientific. I tongue in cheek say you can't do scientific research because the control group always complains. There's you have to do research based on observational studies and analyses of what happened and what could have happened. Could we have been better? So that
The
becomes a
reason they
challenge.
don't want to know, the reason they don't want you to know the control group, because they don't want to be look like a little bit of an inefficient organization. That's the
Yeah,
reason that.
yeah. Yes, of course. I mean, we can't say we realize that a building collapsed on you, but you're the control group, so we're not going to treat you. That doesn't work well, and nor would any of us ever do that.
Yeah.
So in pure science, you have a control group with blind studies. The research in disaster medicine is far more obtuse. So coming up with the best practices, knowing what to do, knowing how to advance. What is the best way to triage? You alluded to that. What's the best method for triage? What's the best model for managing the incident? All of those things are debated within this community.
There was a tragedy in the South Korea, Itaewon. There's stampede. A lot of people died. It was a big, huge international news. Tell us, did you learn anything, or the government or the organization? Is there any kind of studies are done on it, or any lessons learned?
There's in academia, we talk about the literature. There's been studies done on it, and funny you should mention that, because one of the things Wadham does to advance the science and advance the knowledge is we host podcasts and webinars. And within the last week or 10 days, one of our members in Korea conducted a webinar on that incident, and analyzing the factors that led into it, that contributed to it, analyzing the response, and what could have been, what went well, what didn't go well, what can be improved. I have a military colleague, a brilliant physician and I've worked with her husband, and I've employed her husband. He's in disaster medicine, and the doctor says that we're professional pessimists. We're always we always plan for what's the worst thing that could possibly happen. So looking at this clear tragedy in Seoul in Korea, and how do we plan so that doesn't happen again? How do we do crowd control? How do we position medical capabilities? What medical capabilities should be there? Should there be something at the site, or will we transport everybody to the local hospital? How many local hospitals are there? What are their capacities? That's all the science of merging healthcare with emergency management.
So that is a preparedness of the healthcare side. Given that you think that there will be an accident, there will be some kind of a tragedies happen. That's whether you like it or not. Then after the tragedy, how you respond to that tragedy is the organizational structure. Let me ask you a question, another question. All these healthcare workers, they see a mass tragedy like that, people dying on their hands and then in front of them. And are there any mental health issue for these healthcare professionals? Do you and your organization does anything about it, or what is that? What is the general overall about that?
There is absolutely a mental health burden there. There's there have been some there have been some cogent and important lessons that the world has gained from COVID-19, and healthcare. Healthcare is high stress. Every nation in the world, to my knowledge, is facing people are leaving healthcare. Physicians, doctors are going into something else, and to to work with a patient, to work with another human, and to see their life slip away, it is traumatic. And you never get used to that. To see their life slip away for something that may have been prevented is even more tragic. So that stays with people. If you look at, if you not only journal articles, but if you look at media, the trade papers that cover healthcare worker burnout is a tremendous issue all around the world.
Yeah.
But it's particularly acute in the face of a disaster, because by definition, a disaster overwhelms your capabilities. The No, I know the WHO Academy, who teaches a mass casualty course, they opened the course with showing a video of a hospital in Pakistan when there was a bombing. Within 5 minutes, 200 people showed up in the emergency department.
Oh my.
There's just no emergency department in the world that's prepared to handle 200 people flooding in all at once. How do you manage that? How do you control that? How do you make sure that the right services go to the right people? That's the essence of disaster medicine. And how do you protect the people? There's a mental burden. There's also a physical danger. People don't know that. In the United States, there was a bombing in Oklahoma City at a federal building, the Murrah building. 168 people lost their lives. 167 were in the building. The 168th was a nurse who volunteered and went into the building, and because of the unstable structure, she was injured and died. So how do you do work, save lives, including your own?
Don, you told me that you came from a firefighters family of firefighters. So let me ask you: during the earthquakes, some people have to make a decision whether you have a three or so 3 year old a girl you have to save, or 70-year-old man. As a better chance of saving 70-year-old man than less chances of saving 3-year-old girl, and then make it that quick decision at that time. What kind of a trauma that creates in the brain of those people, and how do they do it? And tell me a little bit about that mental decision making process a
The,
little bit.
the decision, and it's something that healthcare workers and governments around the world grapple with. The the main goal, there are a couple of different models, and the WHO teaches some of them. The goal is to save as many people as possible. The difference between civilian medicine, disaster medicine, and military medicine is, in the civilian world, we do everything we can to save people, everything we can. In the military, in a traditional conflict scenario, we realize that we can't save everybody. So there's a triage mechanism where you sort people and you try to save the most. It's conveying that concept to the civilian sector. That's the challenge. We talk a lot, and we teach ethics, ethical decision making, and sometimes the challenge in this, and it goes back to the mental health trauma. Sometimes there are no right there are no right answers. You do the best you can, and you try the best you can. But learning how to sort and how to prioritize who you should pay attention to That's part of disaster medicine is teaching, and that's not something they don't teach
Yeah.
in medical school, dental school, nursing school,
Yeah.
because there's just no room for that.
So there is some kind of PCOM, like a PICOM or PCOM, they call patient outcome information. But still, it is a grappling with the decision making process.
Absolutely,
It's a spiritual. You need to have a spiritual dimension to it, probably at the time.
yeah. There's a couple of different, there's a couple of different triage models. SALT is one of them, and everything. When we first talked about doing this podcast, the key is education. The key is understanding the optimal method to do the best you can,
Yes.
and understanding and accepting that we're all human. We can only do what we can do. When you have you alluded to, but when you have a train wreck or a bus crash, in many parts of the world. In many parts of the world, buses carry far more people than their license are built to carry. If a bus runs off the road and you have a lot of casualties, you do the best you can. How do you optimize what you have, your capabilities and the assets at hand? That's the challenge, and it's all in education. It's all in learning how to do that and how to have the right mindset to do that.
But I'm going to, there is a new kind of a threat coming up in the future. Is artificial intelligence. People create fake threats, real threats, so all kinds of things they could use. So I'm going to present on that quantum side of the, not a threat side, the capabilities, and you can explain probably when I get back, when we get back, you can explain a little bit about the biological, chemical, nuclear attacks that are massive, and then artificial intelligence attacks. That's all together how that soup will work. So let me present a topic on my things. This is I'm going to do that, and we're going to watch together. Okay, so I'm
Sounds
going to
good.
bring you both of us together in the bottom. Okay. So that is a Dr. Donahue. He's a military man and is a distinguished professor. He has a lot of credentials. The world needs to learn some of the things that he's proposing. Uh, I'm going to talk about ChatGPT and quantum computing. This is what is a deadly combo that could be that can create a lot of problems. I'm going to present it first. Quantum computers. I'm going to talk about it. In first analog computer was discovered, actually there was a thing in Antikythera in the off of the Greek islands, 100 BC, 100 before Christ, 100 years before Christ. This machine was designed in the near the Greece. This was there is a lot of wheels. It can detect all the motions of some of the planets. So that was surprising to a lot of people, and the scientists were surprised about this. That's the first discovery of the kind of a mechanized system that the humans invented 100 BC, 100 BC. The next one came in. The next one is humans actually started counting, bones. They used to count the bones, and then sticks. They used to use sticks, to count. That's a counting mechanism they used it. But the first analog computer came in is a Charles Babbage. He invented an English scientist. He invented the Charles Babbage is invented the first. There's a lot of levers. There's a bunch of mechanical levers. You have to do that. So I actually could see when I used to go in the beginning days when I came to this country as NCR used to have a cash registers. That's kind of a mechanized thing. That is a Charles Babbage kind of a machines they were using at the counters in the grocery stores. NCR had that. So after that, the digital revolution came in. Alan Turing is a British scientist, another British scientist. He invented the digital computer, one and zeros, works on the one and zero Turing machine. So that's the revolutionized the humanity. There are three steps. Step one is the analog computer. Second revolution came in digital computer. That is the one and zeros. And then, and the third revolution came in is the quantum computers. That's a step three. It's the quantum computers came from a Richard Feynman. Richard Feynman is a very charming, very colorful guy. He used to go to. He's a professor in Caltech in Los Angeles. He used to spend a lot of time in strip clubs, Gioni strip club. Okay, he's a party guy. Then that is a picture of him in the strip club. He's a frequent visitor there actually. Then in that club, he wrote a lot of equations of the quantum physics equations. He wrote in that one. Those are the drink mats. He took the drink mats. He used to scribble them. They went for auction for $5 million. They went for auction for $5 million. That he scribbled the equations of the path integrals. They call this is how the interactions of the that he wrote all the equations of the quantum physics. What is quantum physics in that sense? It is the it is a Feynman lectures. If you watch a Big Bang Theory, they talked about Feynman lectures quite a bit up there. You know, g- can you put on the mute a little bit? Yours, you can listen. Don, can you put a mute on your mute? It's some feedback is coming. If you can mute on it. Okay, good. Excellent. So you can listen to that. So Feynman lectures came in the Feynman lectures are very famous. He gave a lot of lectures, Big Bang Theory in the talk show. They talked about Feynman lectures quite a bit. So in the Feynman, the what he proposed is in this those drink mats he was writing about this quantum electrodynamics. What is that matter? What is exactly is that how the interaction between the matter and the electromagnetic radiation, how the interaction, what is interactions are. He was giving all the interactions between the electromagnetic spectrum and the matter itself. So if you excite the atoms, it produces the electromagnetic radiation. Depend on the excitement, some produces the light, some produces gamma rays, some produces the x-rays. So depending on the excitement, that the jumping up from one orbit to the other orbit, actually it produces the strength of the electromagnetic spectrum comes out. Then you expose the human body, you can get X-ray. If you want an X-ray, or if you're treating a gamma rays with a gamma rays, you can use a gamma rays. You can take a picture of that. You want to use X-rays, you can do that. So first you start with the matter. The atom produces the radiation. Either a light will, you can produce X-rays, gamma rays, whatever is the ways you complete electromagnetic spectrum depending on the electron jump. So after that, you can take a picture of that, or you can treat. That is then again interacting with the matter. Basically, the matter produces the radiation produces the interacts with the matter produces this is a cyclic process. This is the what the quantum electrodynamics is between the light and the matter. That is interaction between the light and matter. He won the Nobel Prize for that, light and matter. That Richard Feynman is the one is the origins of the quantum computers. Then Richard Feynman wrote a book. He wanted to simulate the quantum computer on the classical computer. Then he realized it is impossible because because the properties of the quantum nature, that he cannot simulate the quantum system on the classical computer. In fact, nowadays we could do a little bit about that, but at that time is definitely not possible because now, yeah, IBM came up with the new chip, Heron chip. It is a 137-bit qubit chip. It just blows out of the water. 1 billion operations it can do. So this is a quantum computers, holy grail. All the companies are dominate this quantum field. IBM is leading, and the Microsoft, Google is struggling, Amazon, everybody is involved in the quantum computing because it can change the way we think, the way we do the things, the way the medicine, everything is going to change completely through the quantum computers. So how fast is this is the one I did a long time, 2 3 years ago. It changed quite a bit, 100 million times. Now it's a billion times faster. The IBM chip is now here on chip is almost a billion operations it can do in than one laptop. That's faster. That is a 5 million laptops it can handle, without a sweat. Quantum computers. There is a traveling salesman problem. It's called a polynomial problem. Traveling salesman problem is, if airlines, for example, if you the to save the fuel, they have to design the routes is how they go about. Uh, it's a very complex problem. It's a classical computer can take thousands of years, but the quantum computer, once we really get it, it can solve within minutes. It, on a classical, the fastest computer available right now, if you on a classical computer, it takes thousands of years. When a quantum computer can do within a minute, that the power of the quantum computers. So a lot of problems like airline scheduling, traveling salesman problem. There's a lot of other protein folding in healthcare. All those problems can be solved through the quantum computers. So, in the one some of the things in the quantum computer in healthcare, for example, the chronic diseases, we don't know the mechanism. We don't have an access to the diabetes, hypertension, diabetes and cancer, for example. All those things we don't know the mechanism inside. All the exact cellular level, at the atomic level, we don't have that combination. We don't have that understanding, that we don't have access to it, because so the space wise and time wise, that's are not accessible to our eye, our things. So the vaccines, that Don is talking about, he was involved in vaccine, COVID-19. We were able to produce a fast producing the vaccine. The reason was we simulated IBM Summit system. The fastest computer simulated a lot of compounds. That's why we could do it. With the simulations, we can cut down the vaccine. In the wet lab, it takes 5 years and years to develop a vaccine. But you could do with the simulations, with the quantum computer systems, with the computer systems, you can do a lot more faster with the fastest computer. But the quantum computer really, really fast. You can really invent a lot of diseases we can solve. Drug discovery is another one. Drug delivery system. All of them are quantum computer is going to change. So IBM came up with they're saying that we have a medical diagnostics. We are doing a medical errors between 20 to 25% is the medical errors there, the wrongly diagnosed. That can be solved through quantum computers. Insurance premiums can be brought down through the complex quantum computing. That's, I don't believe that quantum computer is not stopping them to reduce the prices. There's a lot more political system. There is let me put it this way, is nothing to do with the quantum computers, the insurance premiums. I don't believe that. The precision medicine is social determinants, how you allocate, Don was talking about how do you allocate resources and all those things. Particularly some areas, you have a more burden of diseases, more higher. You have to allocate more resources there. It depends on the burden of diseases and the seriousness of the disease. So you have to change that, rather than silo structures cannot solve the problem. So that is a precision medicine can be done, and also individualized medicines. That is also, it helps social determinants, individualized medicines. They're all going to do through the revolutionized through the quantum computers. So what is quantum computing? A lot of people ask me, I'm teaching doctors, not a physicist or a scientist, computer guys, but it's a simple. I give you a broad example, very simple example of that, how the quantum computers works compared to the classical computer. Classical computer, if you have a maze, if you have a mouse and a cheese, then what the mouse does is keep on trying until it finds the cheese, coming back and hit the block and coming back and keep on trying series of steps. It does. That is what the classical computer do. Series of steps, trial and error. It is a series of steps, one after the other. That you have to do that. That is the classical computer way of doing it. In the quantum computers, something strange happens. This mouse splits into ghost mouse. It becomes all possible. It becomes several ghosts. and travel all possible paths to the cheese at one time, and come back in time and go to fix the shortest distance. Think about that, how the quantum computers work. I'm giving you a very rough example of that. Is basically what it does is it's all possible paths it will invent, because the electron can be in multiple places at the same time. So it will go all at the same time and find the cheese and then fix that distance immediately. That is the shortest distance. That is the difference between in the if you ask me what is the simplest way explaining the difference. So actually, quantum computers, based on two important factors, is the two characteristics is a quantum entanglement and the superposition. Quantum entanglement is the two particles, they're like twins. If the twins are born and they were separated for hundreds of miles, they can feel each other, right? So one person feels a pain in the stomach, the other one feels the pain in the same time stomach. That's it. Similar thing happened in the particle level, whether it happens in the at the twins level or not, but something definitely happens at the particle levels. The two particles came out of the same source, the entangled source. Then they can do they can influence each other. The non-locality system. That's why the Einstein is called a spooky action at distance. He called it quantum peekaboo. He called. So spooky action distance. Two particles, even the billion miles away, they can influence each other. That is one of the characteristics of the quantum phenomena. The second one is the superposition. I will explain this one. It's much easier. In India, there is a god, the Lord Shiva. Is also embedded with a man and woman same time. He was a combination. If you look at him, it's a combination of both. So that is the best way to teach us a God is a combined that man and woman, all of them are one and the same. The way you look at it it makes a difference. That's superposition is the one I explain a little bit more. If you want, superposition is quantum entanglement is a non-local. I explained to you, two particles can influence each other even a billion miles away. One becomes a spin up, other becomes spin down. That's what it is. You can the moment without any preference. If there is no, you cannot do anything. There is no input from you. It takes a random way. It takes one of the positions of the up or down. The other one becomes automatically up and down. Exactly complementary way. So same thing in I will explain to you in the superposition correlation side of it. Superposition is if you have two shoes, your child took shoes, your box, and you put one of the left shoe in the one side and the right shoe is the other side. You put it there. When you're going to the office, you couldn't find the shoe. You open one box. Left shoe you see the left shoe because your child was hiding these shoes in one of those boxes. So when you open the box, if the left shoe is there, automatically you know the other box has the right shoe. That's called a correlation. That is a little bit different than the superposition is more than a correlation. It's a little bit different. What is difference is it will not assume that box will not know it has both left and right shoes same time. That is a strange part of the quantum physics is that the shoe is both left and right same time. Until you open, it will decide whichever you wanted to be. Not without there is no input from you. It could be left shoe, it could be right shoe. The other one automatically other shoe. So without your input, it becomes a shoe. That is called a superposition. That's a different than a correlation. So a lot of people get confused about the non-quantum physics people get confused about correlation and superposition. Superposition is without your input. It takes the last minute before you observe it. It will decide which one to do. So the observation makes the one of the positions to pick up. So then there's a qubit. Is now the quantum computers works on a qubit. Qubit is a one and classical computer 1 and 0 is clearly defined, either on or off. If you want to do the electric lights in the classical computer, you do either off and on, whether this light is working or not. To find out this particular light is working or not, I have to turn it off and turn on. See that is connected with the switch. In the quantum computers, you don't have to turn on or turn off. One position itself can determine whether that is connected with them or not. That's a qubit. That is the power of the quantum computers. So, so that is the chat GPT combo. Now, this power of these quantum computers. I met Leonard Susskind from Stanford. I met him in one of the functions. He said that quantum computers are real. They're coming very soon. They're going to be real. It's already here. IBM announced it. Intel is announced. Google got some computers. Everybody is working on it right now. So one of the now the chat GPT large language models, what can happen with these large language models? They have some entity. Chat GPT is kind of entity. It has some intelligence. It is not intelligent, but it is a large language model. Is a predictor. But if you combine these both of them together one day, we have to be really careful about that. That is the one thing we need to be really, really dangerous of this one. The exponential fraud, exponential porn, exponential dangers of the biological, chemical, nuclear attacks. This AI, quantum computers and AI, they bring together. It is the most dangerous thing that you can imagine. Okay, so we have to really careful about how we are handling this kind of things. We don't have billion dons to help us. We have to be very careful how you deploy these technologies, these new tools that we have now. That's the chat GPT and quantum computers. And next time I'll talk about quantum biology. I don't think we have time much. That's let me bring a Don. So this is we have to really I will talk about chat GPT and quantum computing. These are the deadly combo unless you watch it right way. Quantum language LLMs, quantum LLMs they call. That is going to be, you have to be very dangerous world we are entering into without really preparing right way. Our human race can be extinct. So we don't want to do that. Let's bring people like Don to save us. Don, welcome. So I presented a short topic on quantum computers. What do you think?
Uh, as you were talking, I was thinking, I was sort of reminiscing, and I have here a small device that gets me into the internet. It prints things off. It takes photographs. It does computations for me, and occasionally it makes phone calls too. Uh, the ability to record best practices, critical paths, scientific data, and present so much more than the human can address at a moment. It is a potentially a huge advance in healthcare at large, but in disaster medicine and crisis response. The flip side of that, as you alluded to, though, is chat artificial intelligence learns what it has access to, and the internet and the information flow is unfiltered. So even though more than 6 million people on the face of this earth have perished from COVID-19, there are still people out there who believe that it's not real, and it's a myth, and it's a conspiracy by whoever.
Yeah.
So it's like any tool, like any tool. I think of King Midas. It has the ability to do wonders. It also has the ability to
Yeah.
to do the opposite of wonders.
I that you mentioned very good. That's a I didn't. The benefits are enormous, particularly quantum computer side, large language model. I tell you, there is a guy in Nigeria. He produced a guy who is a very handsome guy, and he ripped off a woman in a year, $1 million, and artificially talking is just you put a different person, a movie actor looking guy. That this is a big problem. This is a it's a huge problem we have to worry about. But the benefits are outweigh, as you say, the benefits are outweighing all the things that we have in the quantum computers can do, drug discovery and the cancer treatment of the treating the cancer and all those things.
Sure. I mean, there's so many. You talked about advances in. Historically, it took the fastest vaccine I've ever seen brought to market. Historically, it took more than 7 years. The COVID vaccines based on almost 20 years of research, but they were able to use computing technology, machine learning, and develop a vaccine in 7 months. That's phenomenal.
Yeah,
The,
phenomenal.
the you know the danger is I you know when I drive I have a GPS, and the GPS has a phenomenal amount of information. It can bring me places I didn't know. But there's studies that show when you follow the GPS, when you listen to those instructions, you do not pay attention to where you're going, and you don't learn the route to and from. You rely on the GPS. So there's a value to the tool, but there's a value to the human aspect and us understanding what happens.
Don, I am getting old. I don't know whether you're getting old or not, but I'm
I'm
getting
old.
old. So we need one of the things that as you got the baby boom generation is coming up and all these things are happening, we need a help from the drones. What is the why the government is hesitant to really it can help the seniors to bring the medicines, to bring the groceries. We need that kind of thing. Why? Or a disaster site, you can deliver, disastrous sites, you can deliver through drones a lot of medicines and all those things. Why we are not really going full fledged on that?
If I understand the question correctly, it's funny. I have a close colleague, and we've been working together for over a decade. And how we met is he published a journal article that said, when it comes to disaster preparedness and disaster medicine, the government needs to tell us what to do. And I wrote an article in response and said the government is the last person we want to tell, the last body we want to tell what to do. That's what academia exists for.
Yes.
So the governments are large, they're bureaucratic, they're ponderous, and they're by definition political. So the in many ways, and it's a personal opinion, in many ways, we need to manage. Tech companies need to be able to control what their products do, the search for knowledge, research. That's one of the main functions of a university. It's not just to teach people and create degrees and qualifications for employment, but it's to do research, just to create new knowledge, to expand our scope.
Sorry for my sorry for my accent. The one I'm asking about is the drones. Can we use drones? What is the role of drones and how we can deploy for the seniors in this country or anywhere in the world and the disaster sites? How can effectively we can use the drones as a mechanism to deliver?
Oh, we absolutely can. There's programs in sub-Saharan Africa. You can use a drone. You can use a drone to deliver medicine to a remote location. You can use a drone to spray fertilizer or insecticides on crops. You can also use a drone to spray toxic chemicals on people. There's much wisdom in ancient mythology. Pandora's box, Prometheus, the discovery of fire. It's a step forward, but it also has a danger. And much technology has that dual-edged sword. It brings us promise. Yeah, again, the internet was designed. The promise of the internet is instant access to information. The reality of the internet is instant access to misinformation.
But
And information, but you need to learn how to sort between the two.
Sometimes the benefits outweigh. You can do medicines, you can drop through the drones because certain areas you cannot even travel, particularly disaster times with the floods or the earthquakes. You can't even travel. So drones can do much good in that sense, right?
Drones can deliver medicines. They can,
Cardiac, cardiac support.
yeah. But
Dumps.
before, if you look at things like Hurricane Maria in Puerto Rico, or many things, the floods in Libya, when there's damage to the community, the infrastructure, before the medical people can get there, somebody has to clear the roads.
Yeah.
Somebody has to establish the electrical system. Drones can support that. Drones can give they can give emergency managers critical information on what's happening. Where are the people? Where are the needs? What roads do we need to clear? Drones, as we're seeing in Eastern Europe, drones can also be used to, for ill will and to destroy people.
But the benefits outweigh that process. So what is your next? Don is a excellent education. What is your next venture? What is you are in everywhere. You're doing from a military to the vaccines to education. Now you are running the disasters. What is the next venture you have, Don?
We are looking to work. We are looking to expand the transdisciplinary, and I have a wonderful mentor, Skip Burkle, Dr. Frederick Burkle in Hawaii, and he talks about multidisciplinary is different disciplines working together.
Correct.
It's working towards a similar goal. Interdisciplinary is people working kind of with each other. Transdisciplinary is like your quantum computing, is everybody working in collaboration to the
Collaboration.
same goal. So it's promoting transdisciplinary development and science. It's creating not only international but national capabilities, working with the WHO, UNITAR, and other non-governmental organizations to promote access to healthcare, promote effective healthcare systems, and effective response to when things go bad. It's phenomenally rewarding. So
Uh,
keeping people safe and taking care of them when we can't keep them safe.
I love that transdisciplinary. My podcast is actually disciplinary of
Absolutely.
healthcare, mathematics, physics, all of them together. So that's going to solve a lot of problems. Healthcare people need to understand that. That's why I talk with the doctors, because the reason is that information, that transdisciplinary system is vital to actually to have a better healthcare system in this country or around the world. Do you agree?
Absolutely. And, you know, healthcare, and this was demonstrated in 2014 in West Africa with the Ebola outbreak. Healthcare can benefit from greater collaboration from cultural anthropology. Talk about people's traditions, people's habits, and what they do. How we deal with, in the case of Ebola or other communicable diseases, how do we deal with the sick? How do we deal with the dead? In West Africa, it wasn't until the people could be taught to change their generations old practices, still respect their beliefs, respect their culture, but change what they do. And that's when that epidemic subsided, when we could change how they do it.
So, Don, you're heading to Tokyo next conference, right? ODM is heading to Tokyo. Tell us a little bit about that and when it's going to be.
WADA meets every biennially. We meet in odd number years, and all over the world. Locations compete, and we have not a competition per se, but organization locations apply, and we evaluate them. We were supposed to be in Tokyo in 2021, but COVID prevented that. We had our first in-person meeting in 4 years in Killarney in Ireland in May of this year, and in early May of 2025 we reconvened in Tokyo. In the meantime, global meeting. All sorts of great experts. Leaders in their field, and we get to learn a lot, teach a lot, but even better, we get to collaborate and connect with our fellow professionals and bond into a community. In the meantime, we have podcasts. We have webinars. We have regional meetings. We collaborate with organizations. 2 weeks ago, I was in Germany speaking at a UN conference on research on climate change. So we do that. We can be found at wadham.org is our website.
Wow.
I am honored and proud to lead that organization. It's some of the best minds in disaster medicine in the world. So it's a privilege. It's a privilege to be associated.
It is a total privilege to talk with you, Don. I thank you for your service. I'm honored to have you on my podcast. It is truly a learning experience. You are a true teacher, and while you are running an organization, thank you so much. If you hang around after the podcast, I will talk with you for a couple of minutes. But
Sure.
Thank you for joining with us. I'm totally Medbix is honored.
Thank you, sir.
1 second, then I'll be just finishing up this task. Just give me 1 second. What happened is I'm trying to, yeah, that's it. Okay, this is the, thank you for.
We are retelling their stories through our patented designs that can be worn on scrubs, t-shirts, printed on conference bags, and endless other promotional materials. Daily Wear for Medicine is the first ever of its kind to create curiosity in medicine through visual art. We at MedBricks are celebrating unsung heroes of the past who made enormous contributions to the field of medicine through our unique campaign called Daily Wear for Medicine. You can wear it, carry it, and give it.